Hi, my name is Helmut Flasch, and I'm going to answer the question I get asked by doctors and by small businesses all the time, and that question is this. I have gotten free media in the past. By free media, I mean public relation, the press writing about me, maybe even be on radio or on television. And yet, I didn't get any patients, or get very little patients from it. Apparently it doesn't work. Yet, I get always asked and have public relation agencies knocking on my doors and wanting $20, $30, $40, $50, $60, and $80,000 to get me a few, 2 or 3 presses a year. Okay, here's the answer. The power of the press is magnificent. It's powerful just the way it says. That said, however, it isn't as powerful as most small businesses think it is. Okay, I have gotten so much press in my life in different countries, and yet it has helped me starting a full business in a different country, so it is powerful. But here's a few things you need to know about the press. Number one, it is not the means to all ends, period. It just isn't. It needs to be working in synergy with many other activities, and that's just how life goes. That's how health goes. Can't have just a good heart, you've got to have also a good stomach, a good brain. For that much, you've got to have good teeth and everything else. Good, that's it. A few things. Most people do not get enough press. 1, 2 or 3 press doesn't do anything. Even if it's 1 or 2 a year, it doesn't do anything. Better than nothing, but doesn't do anything. So a quantity of 10 to 15 presses per year needs to be achieved. Number one. Number two, the press needs to be on different topics, not just about your field. You need to also be in the press as a humanitarian, as a liked person. Like every president, they're in it for what they do as a job, and they're in it for going to the park with the kids and doing this type of stuff. They are made humanitarians, they are made human, they are made jolly good fellows. So you need to get that type of stuff. You need to get a total of 10 to 20 presses per year. So then the press usually is not by the doctor, is not used after the press appears. It's almost the article gets pushed away, looked at a little bit for a few days by you and your staff, and that's it. Sometimes it gets hung up a little bit in the office, some lousy little stuff. No, it needs to be beautifully prepared in a display form, needs to be hung up all over the office, but that's not enough. It needs to be sent out to thousands and thousands of potential clients, or to other doctors and to other to office staff, receptionists, office managers, to the community leaders such as the priests, the rabbis, the fire chief, the police chief, the media, all those people. It needs to be sent to them over and over again with a little bit of a letter and stating this and doing this and making a particular comment on something, but the press release is attached as a credibility thing. Now, you're not advertising anymore. Now you are actually making comments, backing it up with the press, basically explaining the article a little more maybe. That's what it would be with a letter. And all of a sudden you become the endorsed guy, not the advertising guy, because there's only a few people who read that newspaper. You then can send it to more people than the paper actually could, to get it read, I mean. The paper sent out 30, 50, 60, 100,000, whatever your neighborhood is, but you can remind them literally all the time, and you can reuse each press release many times, 1,000 times. So if you get 1,000 and you reuse everyone 1,000 times, imagine what will happen. And we will show you that and other practices on our other free videos, about 10 or 12 or 15 of them, and it's on unadvertised.com/free. That's unadvertised.com/free. The power of the press is phenomenal. However, it's not the only thing, and it needs to be right from A to C. If you don't do it from A to C, it falls apart. Isn't that the thing with all activities in life? If you don't do them all the way through, you're just not going to get a gold medal. The operation will not be going well. You gotta do everything well. Same here. There's a technology to it. It's as precise as pulling a tooth. See you on the other side.